The sort of conversation about air quality and its direct correlation to lowering SSI risk has been one that's been in debate in the literature for quite a period of time. Luckily, we're learning more and more about this as time goes on. And most recently, the ARN guideline for sterile technique and their very detailed literature research has actually shown that there is a direct correlation. And it's something that, as infection preventionists, as infectious disease specialists, as well as perioperative nursing professionals, we should be looking at air quality and how that translates, right, to increased risk for surgical site infections. When I have poor air quality, my SSI risk is likely going to be going up. If I improve the air quality, my risk for SSI is going to go down. And that's really beyond just things like VOCs. It's the chemical contaminants, it's the other biological. And so the ARN guideline, I think, is really the single best source. That combined with looking in the peer-reviewed literature. And really, as a clinician, I want to look at multiple sources of outcome-based metrics that are telling me if I improve air quality, is it truly translating to an improved SSI risk reduction? And I think for healthcare facilities, especially, some do things very well. Others are sort of at a different point in their journey. And so, from a data perspective, I want to look at data that shows me, hey, it works everywhere. It's something that's universally applied if I use this type of technology, that I should see a substantial and statistically significant lowered risk of surgical site infections. And so I think looking at both guidelines as well as peer-reviewed sources is important. And again, the ARN guidelines are really probably the best source of truth that correlate this back. And we're seeing this again in the peer-reviewed literature.